Hi, this class is about asthma and hyperventilation. Here you'll learn what each one are and the difference between the two. Asthma is a disease of the respiratory tract. You probably know somebody in your family or maybe yourself that has asthma, so this is a very common, unfortunately, condition. Asthma is a chronic disease and involves the airways in our lungs. These airways are bronchial tubes which allow our air to come in and out of our lungs. Who gets asthma typically begins in childhood, but it can develop at any age. And you may not have asthma, or a person might not have asthma if they have a lot of allergies. There's somebody that is prone to developing asthma. Occupational asthma, there's some jobs that you can have a higher risk of asthma. So if you're around a lot of dust or asbestos or coal miners or anything like that, in the dental office, there's a lathe that you drill out things, or that you have to wear a mask. If you're not wearing a mask and you're inhaling all that dust, that's not good for your lungs, and then it damages your lungs, and then you can develop asthma. Smoking and asthma. Studies have shown that smokers have a greater risk of developing asthma, as does their secondhand smoke, so children or spouses or anybody around that smoke. Asthma triggers, so pollen, dust, pets. A lot of people are allergic to cats, air pollution, change in the weather. I myself, it sounds crazy, but I am allergic to the cold. So when I go out in the cold, my immune system breaks down and my lungs shut down. You know, not that they shut down, but I've developed this asthma reaction. Exercise, even though exercise is great for all of us, it's something else that could trigger an asthma attack. So anybody who has asthma knows this and will carry their inhaler. There's certain allergens in a dental office that you should be aware of. Eugenol. Eugenol is a liquid used in zinc oxide and eugenol. It's a temporary cement or temporary filling. Because of a lot of allergies with eugenol, a lot of offices no longer use it. But there are other impression materials, resins, and latex, such as latex gloves. And again, because a lot of people are allergic to latex, offices no longer use latex gloves. So what are the signs and the symptoms? A coughing, sweats, tightness of the chest, difficult breathing, a wheezing when they're breathing in and out. Their blood pressure may be normal or may be elevated, but they will have an increased heart rate because their body is working harder to get that oxygen in. So treatment for it, if you're working on them, you're going to of course stop all dental treatment. You can position the patient upright in a comfortable position, have the patient self-medicate with their inhaler, administer oxygen if needed, and then call 911 if symptoms continue. Because a patient can come in and say, I have asthma. Always have them have their inhaler out or ready, so they're not like searching for a purse if they should have an attack. But you never know. You never know. Is this really going to be a heart attack, or is this really something else? Are they really going to anaphylactic shock, or what exactly is happening? So always be on the alert that you might have to call 911. When to call 911? If the inhaler isn't working, if the patient's too weak to walk or talk, or now the patient's lips or fingers are turning blue, which means they're not getting enough oxygen. Unfortunately, you can die from an asthma attack. So just think their bronchioles are tightening down, and if it's so extreme, they're not getting any air. So now we're going to talk about hyperventilation. So as asthma is the lack of oxygen, hyperventilation is too much oxygen. So hyperventilation, or another name for it, is called overbreathing. So it's a rapid, deep breathing that normally occurs when a person gets anxious. So they're overwhelmed with different stress things, and then they start panicking, and in that panic, they're going to start breathing heavy and everything. This happens, unfortunately, in a dental office because they're so nervous. So here's kind of like the cycle. You have work, you have illnesses, you have bills, kids, and you're stressed about all that. You start hyperventilating. Because you're hyperventilating, now you're not feeling well. And now you're not feeling well, then you become anxious, and now you're going to hyperventilate more, and it's going to increase, and that's your cycle. So how to break that cycle. So this is what's happening first. Carbon dioxide is in our blood normally, and that triggers our body to breathe. As a person hyperventilates, this rate increases. By increasing that, you're exhaling too much carbon dioxide, so now your body is lacking it. You're replacing with pure oxygen, and you need that carbon dioxide. So with that, that's when you start feeling dizzy, and you can even have, I'm going to have another slide here, blurred vision and unable to function. So the signs and symptoms: nervousness, increase in the rate of respiration, feeling of suffocation, tightness of the chest, dizziness, blurred vision, and tingling in your arms and legs. So of course you're going to stop all dental treatments. You can position the patient, just calm them. Talk in a calm voice. Breathe in, breathe out, and breathe slowly out like blowing out a candle. Years ago, they used to say breathe in a paper bag. That's no longer suggested, because as they're breathing in and out of this bag, they're really breathing in their own oxygen and not necessarily carbon dioxide, which they need. If the symptoms get worse, you have to always think maybe it's not hyperventilation, maybe it's a heart attack, and so you should call 911. I'm going to tell you a story here. So recently, just the other day, my daughter went to the dental office, and she wanted to have all her amalgam fillings replaced because she didn't like the mercury in there. And so it was a long procedure. She was in the dental chair for 3 hours. She had 4 teeth worked on. They gave her way too much anesthesia, frankly. And with anesthesia, with epinephrine, it makes your heart palpitate. It constricts your blood vessel, makes your heart palpitate. Plus, they had a rubber dam on her mouth, and if those that don't know what that is, that's like a latex square that's up over your face. So when you start feeling anxious, and now you can't breathe because now you've got this thing over your mouth, and so it just causes that hyperventilation. She was hyperventilating so much, she lost her vision. She started having blurred vision. And this is all just from anxiety. Well, I shouldn't say that. It's all from the epinephrine, which led to anxiety, which led her to have hyperventilation. So, something to be aware of when you're out there with your patients. Thank you very much.